Part 3, Attention Deficit Hyperactivity Disorder, acronym ADHD, Issues and Trends, by Dr. Marty Harris. This presentation includes audio that reads the slides. Therefore, closed captioning will not be used. Issues and Trends. Identification. Cultural bias in identification process. Use of medications. Effectiveness. Side effects. Medication versus behavior management. Honoring parents' preferences concerning working with students with ADHD. Identification issues. One critical issue in the field of ADHD is cultural bias in evaluating the activity levels of students. This issue has been researched, and results indicate bias in ADHD assessment is an ongoing problem. For example, white teachers were more likely to identify African American children as overactive than Caucasian children. Hispanic teachers were more likely to identify Hispanic children as overactive than Caucasian children. Issues concerning medication for students with ADHD. Issues about medications and working with parents. A second issue is the use of medications. Questions remain concerning the effectiveness of medications and the side effects. A third issue is centered around how we work with parents and honor their preferences concerning working with students with ADHD. This includes identification issues. Many parents resist the diagnosis of ADHD because they have strong feelings against medicating their child. ADHD and medications. Any teacher that is going to work with students with ADHD should have a basic understanding of medications prescribed for ADHD. The controversy, quote, some parents and professionals believe that too many students are declared to have ADHD and given medication as sort of a quick fix for their challenging behaviors at school and at home, end quote. Source, M. Friend, 2011, page 181. The controversy continued. Concern about side effects of the medication. Concern that students will become substance abusers. Appeal of medication or effectiveness of medication diminishes over time, and families decide to discontinue its use. Effectiveness. Medication is helpful in addressing the symptoms of ADHD in 70 to 80% of the students for whom medication is prescribed. Slightly more than half of all students diagnosed with ADHD take some type of medication. Most common age range for starting medication is between 9 and 12 years. Source, Friend, 2011. Effectiveness continued. Quote, medications bring about improvements in disruptive behaviors and daydreaming behaviors. Improvement in academics does not necessarily follow. Students still need interventions that address educational and behavior strategies. When systematic behavior interventions were used in conjunction with medications, Lower doses were found to be effective. Source: Fornes and Cavell, 2001, Pelham et al., 2000, as cited by Friend, 2011. 3 types of medications used for ADHD. 1. Stimulants. 2. Antidepressants. 3. Antihypertensives. Number 1. Stimulants. Ritalin, Dexedrine, Cylert, Adderall, Focalin. Antidepressants. Norepinephrine, Tofranil, Prozac, Zoloft. Antihypertensives. Clonidine, Tenex. Current trends. The use of medications for ADHD is on the rise. In the late 1980s, approximately 700,000 students were medicated for ADHD. In 2011, 2 million students with ADHD were prescribed stimulant medications. Approximately 80% of students for whom medication is prescribed take stimulant medications. Source: Colin, Barkley, and DuPaul, 2001, as cited by Friend, 2011. Stimulant medications increase the arousal level of the central nervous system, enhancing blood flow to the frontal lobes or increasing electrical activity in the brain. Subsequently, stimulant medications improve functions such as working memory, attention, planning, and self-regulation. Source: Friend, 2011. Factors to examine when medication is considered. 1. The child's age. 2. Prior attempts at other interventions and their impact on behaviors of concern. 3. Parent and child attitudes toward using medication. 4. Presence in the household of substance abusers because stimulant medications are controlled substances. 5. Severity of symptoms. 6. Availability of adults to supervise use of medications, ensuring that medications are taken regularly as prescribed. 7. Participation in sports or likelihood of enrollment in military. In some cases, students can be banned from either of these activities if they are taking medication. Source: Collins et al., 2001, as cited by Friend, 2011. When should medications be used? First of all, remember that schools, administrators, and teachers do not determine when medications should be used. In many school districts, teachers are forbidden to bring up the subject of ADHD when conferencing with parents. Most districts have strict rules that state teachers may not administer medications or monitor the student taking the medicine. Now, medications are kept in the nurse's office in locked cabinets. The nurse administers and monitors students who have prescribed medications. Source: Taylor, Smiley, and Richards, 2009, Friend, 2011. When should medications be used? Continued. Use medications only after Other procedures have been attempted, and a valid diagnosis of ADHD has been made. Carefully monitor the effects and communicate with parents. Provide strong educational programming along with medication. Remember, school districts are prohibited from requiring a child to obtain a prescription. Watch for adverse side effects. Use behavioral intervention and counseling along with medication. Source: Taylor, Smiley, and Richards, 2009. Friend, 2011. When should medications be used? Continued. Side effects of medication to control hyperactive behavior includes both physiological and emotional symptoms. Since reactions to medications are very individualized, teachers need to be very observant of students who are on medications. Teachers, number one, should develop a routine and system to do daily observational notes or checklists, and number two, need to follow district and school policies concerning medications. Source: Taylor, Smiley, and Richards, 2009. Friend, 2011. Physiological and emotional side effects of medication to control hyperactive behavior. Physiological effects: anorexia, insomnia, headaches, dark circles under eyes, nervousness, stomach upset, weight loss, and nausea. Emotional effects: sadness, social withdrawal, self-consciousness, depression, diminished self-concept, fearfulness. In your teaching career, there will be many advances in medication for students with ADHD. As educators, we need to stay informed. That is part of our professional responsibility. That is part of ensuring education is special. References: Friend, 2011. Hallahan, Kaufman, and Pullen, 2009. Eward, 2009. Eward, Albert-Morgan, and Conrad, 2017. Kirk, Gallagher, and Coleman, 2015. Smith and Tyler, 2010. Taylor, Smiley, and Richards, 2009. Turnbull, Sjogren, and Wymeyer, 2016. Vaughn, Boss, and Shum, 2006. This presentation is copyrighted by Dr. Marty Harris, 2017, 2015, 2010, 2005, 2000, and 1998. Thanks for listening.